Are you from Jacksonville originally?
I am not from Jacksonville. So I was born in Germany. My dad's from Oregon. My mom's from Florida, like the Orlando area. And they met. My dad was in the Air Force forever. He finally retired. So he's a pilot, and he was doing like some training in Alabama. I think it was Alabama. And my parents met. And then like 3 months after they met, my dad had to move to Germany. So they just like got married like that. And they stayed together until my mom passed away. But growing up, we moved a lot, Germany, and then we moved to several different states. And then outside of that, I feel like there's nothing I can really complain about as far as my childhood goes. I have 2 brothers, and one's older, one's younger. And my dad, I will say after 9/11, like my dad was gone pretty consistently. That would be the only thing that I think could have affected me. Even my dad, like admittedly, was like, I think me being gone so much may have led to some like insecurity. And one thing I don't normally, because I speak at, nursing schools and stuff, I don't mention this just because I want to like respect my brother's privacy, and I know they don't care. I've asked them. So growing up with my dad not being home, like he was home for only a couple months at a time, like my entire childhood. There was a point when he lived in like North Carolina and we lived in Florida. So, your original question. So we ended up moving to Destin, Florida when I was 8. And we ended up staying there because my dad, the Osprey is what he was flying. It was stationed there. So thankfully I had that, I got to stay with friends it was like 10 years in that place. So my little brother, I would say I was like a freshman in high school. My little brother was texting this guy, and I saw a text. And that day he came out as gay. And, nothing wrong with that at all. But we were, I guess, I don't know the right word, conservative family. We didn't talk about mental health. I know there's addiction that runs in my family, but it was hush. Like you just say, oh, he had, my uncle had a problem with pills. But that was, nobody knew what happened. No, really, we just didn't talk about it. So my brother coming out, we didn't tell anyone. And he was very young. So yeah, he was in middle school. So we didn't tell anyone. So I kind of like had to internalize that. I didn't tell my friends. My parents were like, he's confused. He doesn't know. And now, just as an update, he's still gay. He's amazing,
It's amazing.
And he's so happy. And he's happy he came out when he did.
Yeah.
And a couple of years later, my older brother came out as transgender. And I think my parents kind of blamed my dad's not being present as much as he could have been for these things. And I hate to make it sound like that's a negative thing, because it's not. And so many things have changed now.
Yeah.
And I'm so thankful that things are changing as far as that goes. But I think that put a lot of pressure on me. My dad, like verbatim, would say, like, Katie, you're my boy, because I did everything as it's supposed to be. I was a cheerleader, and I always got good grades, and my brothers didn't care about school. Amazing people though. So I don't want that to sound negative, but I felt like this pressure to be like, I guess, like the golden child, if you will. But outside of that, growing up was nothing else, relevant. I was very close to my mom. So yeah.
I feel like I understand what you're saying. There is nothing wrong with being gay. There is nothing wrong with being transgender. You were speaking to your father's reaction to it. 20 years ago, 15 years ago, or even 10 years ago, society was saying no, like, oh my God, you're gay. So your father isn't right or wrong. He was just acting accordingly to society and what society norms are.
And he's completely changed since then. Like, he is unbelievably supportive, and there's nothing wrong with it.
Right.
And I'm so glad things are changing with that, and it has changed. And just to clear it up, my older brother, I refer to him as he. So the pronouns, he hasn't fully transitioned to make that, I told him, like, let me know when you want to change your pronouns. And he still goes by he. So I just wanted to clear that up.
Yeah, for sure. For sure. No, thank you for sharing that. And I think it's also important to now looking away from your brothers and looking at yourself. That's a lot of pressure on you.
People go through worse things.
No. But everyone has their issues that they deal with, right? And your issues are real issues. I didn't have anything crazy in my childhood. I was, my father was a semi-pro athlete, and my middle brother and my oldest brother, they were good at sports, but like I felt like I was the one who had to get the scholarship. I was the one that my father can go talk about to his friends and brag about. I had
dynamics like that.
Right. Yeah. I wasn't, sexually abused as a kid. I wasn't, what some people go through, but that doesn't discount your feelings. It doesn't discount my feelings. It doesn't discount what we went through in our stories.
Very true. I've had to learn that because even with everything that I'll share today, I've struggled with that where I'm like, people go through even your podcast, what I've listened to, these incredible people who faced like so much adversity from a young age, like from the day they were born. It's hard. It took me a long time to get out of that where I'm like, these still are things that you went through just because it's not as traumatic or difficult as like what other people have gone through. It's still something though that affected you.
Right.
Not
comparing. And it's your story. So you're in high school. Where did you go to college?
I went to Florida State University in Tallahassee. So I like dual enrolled my senior year of high school. I'm like, I want to be a nurse. And I was like very focused. And I did what I said I was going to do. I'm like, I want to be a nurse. My backup is to be an elementary school teacher. I got into nursing school, joined a sorority, like the whole, sorority thing. And Florida State is such a known to be like a party school. And I did, I got into the world of like drinking, going out, but I was still able to like maintain my focus on what I was doing. Like I knew my end goal. Like I want to be a nurse. I'm going to stay focused. But I will say there were certain occasions where I felt like I would drink more in certain situations than, some of my friends on occasion. And I think, I don't know, the part of my brain, I could tell like sometimes I would want to stay out like longer than a lot of people. And that's normal, but there's something in my brain that I think I didn't know when to stop certain things, So thankfully at that point, it didn't affect me to where it got out of control. And then after college, I went back home to Destin and I'm like, I know I want to work in labor and delivery. I loved it. So I found a job here in Jacksonville. So I worked in labor and delivery for, I say 6 years. It might've been 8 years. I don't know, one of those. So, I had a short-lived career. I should remember, but I think 6 years. And I loved working in labor and delivery. It was like my passion. I loved the intensity of it. It wasn't always intense, but I loved it so much. Yeah. And it got that like adrenaline. Like I'm pretty impulsive and high strung. So having that atmosphere, I just loved it so much. And I did not divert drugs or anything at that time. So yeah, it was great.
So when you moved to Jacksonville for the job, where is your relationship with your parents? You were very close with your mom, right?
Yes. Yeah. So it's like a 4.5 hour drive and I would go home a lot. This was before I had kids. I would either go home or they would come visit. I'd say I saw them when COVID started, it kind of got, less and less, but every month or so, maybe 3 months, 4 months. I wouldn't go more than like 4 months without seeing them. But my relationship with my mom, she like was living my life through me. I would text her everything. I was like, I can't even think of an example. One bad thing happens, I call her. She would guide me through everything. Like her kids were her life. And my brothers too were so close to her and we're close to my dad, but not like that. Like I wouldn't, go to him first.
Yeah.
And, so do you want me to keep going or did you want to? Okay. So I, meet my husband at Mellow Mushroom. There was like a $1 wine night. I was with my roommates and my husband now.
That's here in Jacksonville?
Beach. Yeah. Jack's Beach. Yeah. So we were both living in Jack's Beach. I had 2 roommates. And yeah, I just met him. And I'd say like within a month, I was 22 at this time. Within a month, I was like texting my mom, like, I feel like I can marry this guy. Looking back, I'm like, I was so young, but I knew he's somebody that I could see myself with. And we ended up moving in together after a couple of years. I was still working in labor and delivery. And I got pregnant. And in 2019, because I had her in 2020, COVID was happening. And I brought my now husband, while I was pregnant, I brought him home with me to see my parents. And I saw my mom, she had a fever. We like went out on my parents' boat, but she didn't come. So this was about 8 months before, it got bad. But I was like, Mom, you have a fever? And she's like, I'm just not feeling like myself. And I remember crying then. And I was like, Mom, I said this, if anything ever happened to you, I was like, I can't even fathom the thought of anything happening to you. Like, do you promise you're going to go see a doctor if you're still sick, figure out what's going on? And we kind of just like didn't talk about it again. I was like, okay, maybe she was just sick. And then COVID happened. I had my daughter, and my husband and I got married, and my parents came and visited us 2 months after having my daughter, or it was like a month. And yeah, my mom at that point, when I saw her, we were still talking every single day, like texting. She didn't call me as much, but we were texting, and she seemed different via text. She's using a lot of emojis, like her sentences weren't, making sense as much. And I just chalked it up to, I don't know, maybe she's just weird this week. I don't know. She's weird. And so she was so yellow, so jaundiced when I saw her, and they only stayed for like a day. And my mom walks in with like, she had gloves on, like plastic gloves, when she came to meet my daughter, because she claimed she had COVID, and she had a mask on, just like fully covered. She had a jacket on that she wouldn't take off. And so I think looking back, I'm like, maybe she was trying to like conceal what was going on. I don't know, but I should have recognized it more. And every time I talk about it, I get emotional, because I should have seen like these warning signs and said something. And I didn't. And she's like, I'm so bloated. And it was just so obvious that she was not well. And they left after meeting my daughter for a couple of hours. And, I like texted her, and I'm like, I'm so happy my best friend got to meet like our new best friend. And I didn't say anything to her at all. I just let it go. And I'm like, it's gotta be nothing. Like, I think I just had a baby. I was like, my mind's like playing tricks on me. I don't know. And, so I get a call from my dad it was like a month later. And like, I knew right when I answered the phone, and I was just at home with my daughter. I was still on like maternity leave. And so I hadn't gone back to work yet. And yeah, I knew right when I answered the phone that there was something going on, because he's like, and he was already crying, and I like never seen my dad cry or heard him cry. And he's like, we have hospice here at the house. Mom is dying, and you need to get home. And I just never, have you ever had a moment like that where you just, I don't know how to explain it. I like crumbled to the floor. It was just like the most surreal feeling. I just like screamed. And again, I always, say that people go through worse things in life, like people's parents pass away. But it was the most devastating moment of my life. And I, made it home. I was going to bring my husband and my baby. And she was so high maintenance at that point. And I knew, like my dad said, we don't know how much longer. Like, she's been sleeping for a couple of hours. And I was like, oh my gosh. So I just left. Like, I packed like within 10 minutes, and I just left and made it home. And she was already, just seeing her in that state, in her bed. It was, the most saddest thing I've ever seen. Just seeing her, she didn't even, she looked like herself, but not the mom that I knew. And I felt so bad for not, saying anything or making it, being able to say bye to her. Like I know she wanted to protect us, but I should have stepped in when I saw all of these warning signs, and I should have, like, I'm a nurse. I should be able to recognize these things. And I felt so selfish and so consumed with my own self that how did we let this happen? Like, I was mad at my dad. I'm like, Dad, how did you not know? So yeah, she passed away within like 30 minutes. And I don't know, I laid in her bed with her for so long. And after that, I stayed at my parents' house for a couple days. I like flipped a switch where I'm like, okay, I need to focus. Like, I have a daughter. I need to go back to work. And I just internalized it. I went through that and just, I didn't even consider seeing like a grief counselor. And my dad would say that. He's like, I think we all should probably see somebody, but I think we can push through. He's like, we have each other. We're going to push through. So we did that. And, I was struggling after, but yeah, I was raised to just, you push through. Like, you can get through anything if you just like are strong and you push through it. I have my second child, and I still, I keep working and, pushing through everything. And I start working. I left my labor and delivery job to work at this small surgery center. And it was much less intense. No weekends, no holidays. So I wanted to stay in labor and delivery because it gave me that fulfillment of like the intensity and like watching childbirth. I was so passionate about it, but I was like, well, I have 2 kids now. Like, it's time to maybe settle down. I want to be home during holidays. So I switched to this place, and it's very calm. And looking back, I think that I missed like the intensity of labor and delivery, but it was still great. And I had an elective procedure done when my youngest daughter was 5 months old. And I was prescribed 72 Percocets at that point. And I took that first one. And it was actually 2 prescriptions. It was accidental. So the first one was, what's half of 72? 36 of them. And another provider sent another one on accident. And I didn't know that until I finished that first 36 pills. And I'm like on my Walgreens app, and I'm like, there's another one. So I filled that one.
Mm-hmm.
And so I took all 72 Percocets. And I think you mentioned before, like the same feeling, just all this stress and weight just fell off. I felt like it fixed me. I was
chaos
feeling, and I don't know if
gone.
I went into all of that, but just the anxiety that I was feeling after internalizing a lot and just, not seeing a therapist. I have really bad anxiety as it is. So, adding the stress of maintaining a home, we had bought our first home right before I got pregnant with my first daughter. So we didn't exactly adjust to owning a home that we need to maintain. And then, having 2 kids, like throwing that in the mix, and my mother's death, and then COVID. So I just felt like, this is amazing. This is like what I used to feel like, is how it felt. And I didn't think of that as a problem at the time. And I don't know why. I don't know if it's, addiction will convince you. They are known to do that clearly. So I was like, it's not a problem. What if I just, the rest of my life, I find a way to take a few of these? I will be cured. Like, I'm going to be myself again. Like, this is great. So I went back to work after this procedure, and after I ran out of those Percocets, and we only had IV fentanyl and Dilaudid, and we kept it in this back like cabinet
At the medical center you're working at.
Yes.
Okay.
Yes. So this is not labor and delivery.
Yep.
So anyone who works in the medical field, it was not a Pyxis, it was a cabinet, and there were 3 nurses at this particular facility. I was the person who came in to open the place, and I was responsible for moving IV medications from that cabinet. But there were boxes of like 25. I mean, it was a full stockpile of IV meds, and I would move them to our daily stock, which is like a basket. And the daily stock were the medications that we gave to patients. So I look at this back stock and I'm like, and I remember that day, like it was yesterday, where I'm like, if I open one of these boxes back here and I take a vial and I bring it home and I just give myself I can mix it with saline, just do just such a small amount. Because I was scared, I'm like, what if I overdose myself? And the beauty was that I knew how much it was and I knew how to do IVs. And I mean, at that moment, I abused my position that I had by doing that, because obviously I made the choice to put one in my purse. And I remember just like that back and forth that I had that entire day at work. And I convinced myself that, well, there are other people who've diverted before. We don't really know what happens to them, but what's the worst that's going to happen? I'll just get fired. That's the worst. I didn't think of it the way that I think about drinking and driving. It just didn't. I don't know why I didn't, because I should have. And that's what kind of propels me. One of the reasons speaking out at nursing schools and speaking wherever I can, because I firmly think had I heard a story like this, I think I at least would have gone back to that moment in nursing school, hearing that story. And I don't know for sure, but I think maybe I wouldn't have done it. Maybe. I don't know. But I did it. And I waited till my family was sleeping, and I drew up like a really small amount and I did it. And it felt like the Percocet, but it was immediate and better. And I kept doing it. I would take from that backstock area, bring them home. And I thought that I was going to quit every single time I did it. I would say this is the last time, never again. I'm not addicted. It was an experiment to me every single time. It wasn't a problem. It was just a little mistake that I can fix. And I got really sloppy with my charting. And that's not because I was high while working, because I would wait, at least at that point. I did this for 4 months, and I don't want to share too much, but I wasn't doing it on the job, but I was leaving early. I was the first one out the door so I could get home and do drugs. And I would take them for the weekend. The weekends were like my time to do it. So yeah, I got sloppy with charting to cover up for my theft. And I think it just became like my focus. If my kids were sick, I was making sure I could still work. My husband was having to sacrifice his job so I could make sure I got what I wanted from work. And so, yeah, I was caught due to forging a legal document, a doctor's document, to make up for my theft. Do you want me to go into detail about?
Yeah. How did you, well, first off, were you refilling those with saline?
No.
So you
though, at the end.
You were just taking them from the back stock,
Mm-hmm.
and the back stock, they don't do inventory on?
They do not open. So they wouldn't open the boxes to make sure that they were full. They would see. So for example, we would have 4 or 5 boxes of 25 vials of fentanyl.
Okay.
I don't remember the dose, but yeah. And I would cut a hole into the side. So there was a plastic wrap over, the box. And this has been very helpful for hospitals that I've been talking to, the pharmacy staff, because what I did was very sneaky. And yeah, I would take a vial out and that box would be missing, 5 vials. And then I would forge documentation. And that's why I have been able to, I can confidently say that no patient suffered in pain. The possibility was there. Had I been doing this for a year, I don't know what I would have done. But at least during my addiction, I would say that a patient was in pain when they weren't. And most of our patients weren't in pain. They just got out of surgery. They would wake up and then they're, out the door after an hour or so. And I would just chart, because I was also the recovery nurse, and I would chart that a patient needed pain medication when they didn't. And then I would take it from that daily stock and I would slowly replace them. So I had this whole like juggling act going on. So the week that I was fired and I forged that document, I had the story. It's such a weird story, but it's the truth. So I had a wedding to go to. I was going to be in my friend's wedding, and we were going to Cabo, Mexico. And so the week prior, there was one box of Dilaudid left in that back stock. It was missing half of those vials. There were 5 vials just missing. Nobody had opened it. I thought that I couldn't order the new medications, which is probably a good thing. So I had to wait for a provider to order new ones. And I kept asking, I tried to be subtle. I'm like, did you order more? Did you order more Dilaudid? And they didn't order any. And I kind of started to panic. I was going to be gone the whole next week. So I'm like, they're going to have to open this box next week. They are going to see that half of these vials are missing. It was 5 out of 10 of them. And so I start panicking like real bad. And my daughter, the same week she had RSV. So I had to miss 1 day of work that same week. And so at this point I have like 2 days left that I need to figure out a way to cover up for these and forge documentation. So I panicked and I forged I don't want to give too much detail, a full document saying that somebody received like a lethal dose of a medication. And my plan was to replace, those with the daily stock, if that makes sense, so that I can go on my trip and that box looks full. And they found the original document. Somebody did. And I think I just put it in the trash. The original one saying that they hadn't gotten, I hope this makes sense. Mm-hmm. So somebody found it, and then they pulled up the chart and they saw mine, and they're like, wait, did you do this? And I forged a doctor's signature and everything. And I was like, oh, I lost it. So I just redid the whole document because I was nervous to ask the doctor to redo it. So I just did it myself. And that same day it was the next day I was fired. But so I go home that night that they discovered this document, and I made a plan that I was going to cancel my trip. And this is when the refilling took place. I grabbed empty vials, and I had a lot of empty vials and lids in the back. I had a spot in my husband and I's bathroom, like in a cabinet. And it's just looking back, I'm like, I can't believe I got to this point. But yeah, I pulled a couple vials of Dilaudid that were empty that I had used. And I grabbed the lids, any lids. And the next morning on my way to work, I stop there's a gas station very close to this facility. And I stopped there and I'm like, do you have any super glue? And they had to go to the back and they got super glue. I bought it. I go into the facility and I filled 5 vials with saline and I glue the lids on them. They were so sloppy. They were horribly done. And I put them into that back stock, and I put them into that box back there, into that stock, so that box would appear full. Mm-hmm. Cause I'm like, okay, they've got to be on to me. So I'm going to cancel my trip, which I did. I texted my husband, my mother-in-law, and I'm like, okay, I'll explain later, but we cannot go on this trip. I need to work. I'll explain why later. Nobody knew about my addiction at this point, So my husband's like, okay. And I volunteer to work the following day and the whole following week. I told my coworkers that my trip was canceled. And I'm like, I can come in and work tomorrow. I just really want to work. And this was my last ditch effort. And my plan was to work and replace those 5 saline vials. I just wanted that box to look full in the meantime. So I did that. I put them into that back stock. I worked that full day. At the end of the day, I was terminated. My, employer sat me down in her office and she's like, after you forged this documentation, she's like, I have to let you go. And I was in such denial that I I didn't think that I would be fired for that, because I think my addiction, I was just so deep in, I was in complete shock. So after I'm fired, I go to that backstock cabinet and I grab those vials. I accidentally left one of them, but I grabbed the 4 vials, and I'm like, to my coworkers, I'm like, look, our stock is going to be short some vials. I'm just letting you know. I'll explain later. And I just left. And my employer called me and had no idea what was going on. I think they thought that I had taken taken actual drugs, not the saline filled ones.
Mm-hmm.
So I came back after she called me, and they asked if I could return what I had taken. So I returned them to my employer, and I said, those are filled with saline. I'm just letting you know. And I didn't fully explain the whole story of what happened. I just said, I have an addiction problem. And it took me like 20 minutes for me to finally admit that I had an addiction problem. And I mean, I felt really relieved once I did, when I did tell them, but I was so like ashamed of myself. But, the feeling of just knowing like it's over now, like it's over. I don't have to live like this anymore. I think I wanted to stop the whole time. And I don't know, just the thought of, had it gone on for another year, I truly think I would be dead. I would have, it was progressing like so rapidly. So those saline filled vials were turned over to the FDA. So the FDA investigates these things, and I didn't know any of that. And so while the investigation was going on, they have to test these vials. The FDA has like a lab, and they tested those vials. That takes apparently almost a year for them to test them and get all their evidence together. Because this is, it's extremely dangerous if patients would have received those. And there are situations where patients have died because people have refilled. There was somebody in Jacksonville. He did that for a long time. He did the refilling with saline, and patients were receiving those. He took the drugs and they received them. And he ended up transmitting hepatitis C, and one patient died. So he was sentenced to 30 years in federal prison.
30?
So they don't mess. Yeah. They don't play with that, which they shouldn't. And so, I was arrested by the state first for obtaining a medication by use of fraud. And they put me on like pretrial intervention. I did 6 months of drug testing classes, which I needed. That was great. And I got done with that. And I'm like, all right, like life is going to start again. I had been sober since the day that I stopped, or since the day that I was caught. And at that point, within the week of the state dropping their charges, the feds arrested me, and I was sentenced to 9 months of house arrest. And I'm a felon now, convicted felon, and I deserve that. I know that I deserve it. And I think had this gone on longer, like I said, especially if a patient had been harmed or received one of those saline vials or sat in pain, I would be sitting in prison for a while. I think I am so lucky. I'm so thankful that I was caught when I was, before it really got out of control. I feel like I'm talking here.
No. Thank you for sharing all of that. Do you think that God intervened and made sure no patients got any of those saline put in their IV?
I feel like divine intervention, something. Because, I can sit here and say that never would have happened. I knew to take them when I was fired. I never would have allowed that. But the fact that I did it and I let them, them sit there, I think so. I think there's something. I am just so grateful that it never got to that point.
Yeah. What did your husband say when he had no idea you were using for those 4 months? You lose your job, and then now you're under an investigation. Mm-hmm. When you bring this to him, and I'm assuming your in-laws found out as well because of the trip cancellation.
Yes.
What did they all say?
they were shocked, so supportive. My husband really, when I told him after I was fired, he had absolutely no idea. He kind of just sat there. He didn't even have like words to say. He was like, that's the last thing I was expecting you to tell me. He's like, I don't even know what to say. He was very supportive though, just completely. Same with my dad, same with my in-laws. I hid it like very well. And my husband has been supportive throughout the whole thing, but I don't know if it really, just because it was a shorter period of time, my husband, it took him a while to really understand how deep in I was. And he gets it now, but yeah, it was just complete shock. And yeah.
When was your last use? When did you take from a vial last and shoot up?
It was before I forged that document, when I started to panic. So I'd say October, mid-October of 2022.
Okay.
So yeah, 2 years. And then as far as I did start drinking a couple months, it was after my first arrest. I hit this really, really like the lowest place that I had been, and I had been low before, but this one, when I realized, I had done this to my family and I could be facing prison time. I had a lot of like mental issues with just myself. I'm like, what kind of, psychopath does what I did? I have 2 daughters, and I thought maybe I had a personality disorder for a while. Like I had a lot of issues. Just why did I do this? How did I allow myself to, do this to my family, to my kids? And I've, since I've gotten therapy, and I'm in therapy every week, and I'll be in therapy for the rest of my life. But the blame was something that was so hard for me to handle.
The shame and the guilt. Yeah. But you want to know what? No one got hurt. Thank God. Mm-hmm. No one got hurt.
Yes,
and
they would have eventually. So that's one thing I just want to make sure I really harp on. It's that just because I say that, no patient was affected, no patient sat there in pain, it was like well on its way to happening.
Yeah.
I mean,
well, from an accountability standpoint, you are here on my show talking about it. So you are taking full accountability. That's not, I'm just saying, thank God nobody got hurt.
Yeah,
and that's why I was asking the question. No. That's why I was asking the question before, do you think it was like a higher power moment, where, God made sure nobody got hurt.
I think so.
Because imagine dealing with that, guilt and, it would have been tough. But so now you are doing fentanyl, that comes to a very hard stop.
Yeah.
Then you go through the drinking pattern. Mm-hmm. When do you pull yourself out of the drinking, and what do you do? You said therapy. What are some other solutions that you have implemented in your life? I know for a fact that you help others, and helping others is huge. So what are some tools? What are some tools that you've implemented?
As far as, because I have a lot of anxiety. I mean, I lean on people a lot more. I don't keep everything inside anymore. If I need a break from my children for a little bit, I'm such a people pleaser. I'm deep down, to my core, I am a very insecure people pleaser.
Same.
I mean, it's bad. Yeah. And working on boundaries, I've learned that I am allowed to have boundaries that I stick to. I don't need to do everything for other people, and I'm able to do what I need to do for my own mental health. I say no to social endeavors if I need to. And my husband also, he's working on that too. And it's not that he's necessarily a people pleaser, but saying no to just anything that we feel like could be a potential situation, like drinking, going out with people, things like that. It's like we're not letting people down by having boundaries to keep ourselves healthy. So that's something that took a while for me to really learn to be able to do. You know, people aren't going to not like you if you don't, you know, if you don't do everything they want you to. So
for sure.
yeah.
Insecurity, I would people please constantly, and I still do sometimes because I do have insecurities just like yourself. And that is common amongst people who struggle with addiction. It's very common. Setting boundaries is like, well, I don't want to let that person down. Well, at the end of the day, you need to take care of yourself because that's what matters the most. And setting boundaries is so important. And I feel like people don't, you know, they look past setting boundaries and don't realize the importance and how detrimental it potentially could be to your own well-being if you're not setting boundaries.
And one other thing I was thinking about, because I'm curious with you too, when I did start speaking out and talking about this, I remember it wasn't just one thing that I, you know, one time, it was several times I had this thought where, well, on house arrest, I'm like, okay, I could just keep this inside, never talk about it, never, you know, never get out there and try to help people and just, you know, move past it completely, just never think about it. And I'm like, or I can try to give back and do what I can to prevent anyone else from going down this path. And you just said that, you know, that helps. But I think that's the number one thing for me. I could be wrong, but I feel like just getting out there instead of keeping it within myself and just like the turmoil that I felt within myself of I did this. And if I don't, you know, if I don't share it, I'm just going to keep this inside me. You know, it's a part of me that I feel like I don't want to hide it. And I think that would have not made me use again necessarily, but it could have, because it's been really, really helpful for my mental health to just get out and like talk about it. And that's why I love your podcast so much.
Thank you. But that's the biggest difference between yourself and someone who's a chronic relapser. Someone who's a chronic relapser
really? Okay.
doesn't. Yeah, no, that's common. Like people who constantly relapse. So I go to a 12-step program, and in the 12th step, a 12th step is helping others. You can't keep what you have unless you don't give it away. So I said that wrong. You keep what you have by giving it away. Sorry. And right now you're at this point where you've accepted and taken accountability, and you are keeping that acceptance and accountability by going out to different facilities and, you know, places, you know, of your old profession and helping others. And that's initially where I ran into, well, we connected, was you sharing your story and helping other people.
So many people commented and tagged you, and I'm like, okay, I guess I need to see who this guy is.
No, but
I love what you do.
It's,
you know that.
I appreciate that. And, you know, you should hold your head up high because like there was shame and guilt around what happened, but A, thank God no one got hurt. And B, you don't know how many people you saved up to this point of helping people and how many more people you're going to help and save down the road.
Then other people might help other people too.
Exactly.
I was floored at how many people, even like when I speak at schools, but also on like social media, how many people can relate, whether it's them, a family member. I was absolutely floored. Going through it, at least working in a hospital for me, like I said, the people who had diverted in the past, nobody really knew what happened to them. It was like, I didn't even think they really existed. I'm like, you don't know what happened to her.
Yeah.
And it wasn't talked about a lot of the time.
Yeah. And
so, just seeing how many people do go through it, I'm like, I feel like it needs to be talked about more. So,
and community, you were talking about, you talk with a lot of other people and like you've built community. And what I like about us is we've built a platonic relationship, like a friendship. And, you know, I've bounced things off of you and you know, vice versa.
You said platonic.
Yeah. Like
we are not dating.
No, but like we're friends. No. Yeah. Like, but that's the beauty of it. Like an opposite sex relationship.
Yes. No,
that, you know, you like helping one another and that's what it's all about. We're all not alone in this journey. And really quick, you have 2 beautiful daughters. How is life today?
Great. Better than it has been for the last 2 years. I think my perspective has changed a lot, especially after house arrest. And God, I sound weird saying this, but I truly think this is the best thing that could have ever happened to me. My whole view on being with my kids, and just life, being able to leave my house now. I just got off house arrest. Like, life is so beautiful. It really is.
I don't mean to laugh. It's hilarious. Like, you just don't fit the description of someone that would be on house arrest. Yeah, I'm off.
I know. I'm so happy though. And I deserved it. So, the description can be anyone. It could happen to anyone.
Yep.
And I could have been sitting in prison for 10 years. And yeah, it could really, truly happen to anyone. And that's why I want to talk about it, because I didn't think it would be me.
Yeah.
Here I am.
How have things been with processing your mom and whatnot? You go to therapy, I'm assuming that helps a lot with that. And have you been able to kind of process everything?
Yes. I don't wake up at night crying.
Yeah.
It was really rough. I know now to acknowledge what is going on in my life, whether it be, argument with my husband. I cannot allow myself to internalize the things that I'm going through. And it's helped me learn to communicate with even like my kids, learning to have a voice and talk about things. Like, you can open up and talk about problems and things that are going on instead of just moving on and internalizing everything. So it's helped me in so many ways.
Awesome.
Every way.
Well, Katie, thank you so much for coming on.
Yes,
thank you for sharing your
me.
story. You help so many people, and it's truly an honor to have you on.